Welcome to Yours in Health and Human Services. YHHS is a program brought to you on behalf of the Rockingham County Division of Health and Human Services and is designed to provide the most current programs, services, and events for the citizens of Rockingham County.
Good morning, everyone. This is Katrina White. I am the Health Education Program Manager and the Public Information Officer for Rockingham County Department of Health and Human Services. And it's another episode of Yours in Health and Human Services. And we are happy and so fortunate to have Ms. Kim McNeal. She is the supervisor of the Family Care Coordination Program, and she also oversees the very important programs such as the such as the care management for at-risk children, as well as the care management for high-risk pregnancies. Welcome, Kim. We're so happy to have you here.
Thank you for having me, Katrina. It's a pleasure.
Yes. And so what we're going to talk about today is pretty much what does your program do? What kind of services do they provide for the county? And first I'm going to ask you, what are the care management for at-risk children? What does that mean? What is the program?
Well, like the name implies, we work with children. Ages 0 anywhere up to their 5th birthday.
Okay.
And we work with any child in the county. Doesn't matter if they receive private insurance, Medicaid, or don't have insurance at all. And we receive referrals from pretty much anybody that has a concern about that child or family. A lot of the referrals come from doctor's offices, our WIC office, our partners at DSS, and we also have families that self-refer that they've either been in our program before or they know someone that's been in our program before. And pretty much we work with families and children where either the child has a medical need, a developmental or psychological need, or there's a social issue that makes that family just a little bit more at risk and needing some supportive services that we can provide. We also work with foster children and foster families to provide a little extra support and a little extra help to the very busy foster care workers, just to make sure that, again, families, children get the services that they need, referrals to other community agencies, just to make sure that those children are getting, the services that they need, the health care that they need, and any other concerns or needs that their families or caretakers see that they have.
Wonderful. What an awesome program and a benefit to the mothers and the families here in Rockingham County.
Yeah, we have, in what we call normal times, we make a lot of home visits. Right now we're doing a lot with the COVID pandemic. We're doing a lot of telephone calls, but we work closely with our clinics, the WIC clinics, doctors' offices. We'll see a child in any community setting that the family is willing, or in their homes.
Yeah. Well, that's wonderful, Kim. And on the same token, what is the care management for at-risk pregnancy program?
Again, like that title says, we work with pregnant women. Anytime during their pregnancy, we can pick them up through 2 months postpartum or after the child is born. That program is for Medicaid recipients. It doesn't matter what kind of Medicaid they have. And the majority of those referrals come directly from their OB offices, the OBGYN offices, mostly from the ones in the county, but we can see those ladies that are receiving care outside of the county. They fill out what we call a risk screen that goes through both questions that the patient answers and then questions that the provider answers. And then we look at it to see which women are most at risk for difficulties in their pregnancy. And again, these women can have a health care issue that is either ongoing before their pregnancy, or some of the healthcare issues like hypertension, diabetes, those sorts of things that some women do develop during their pregnancy. Or they can have, a psychological, behavioral health issues, or as social issues that just makes them, like I said, we want to make sure that these women, number one, get to their prenatal visits and receive all the medical care that they need, but also the other supportive services, making sure they have that Medicaid so that they have proper insurance both during their pregnancy and afterwards, and any other community-based services. Because our goal with the care management at-risk pregnancies, that we want a full-term, happy, healthy pregnancy for both mom and baby.
Absolutely, absolutely. Both wonderful programs. And you was telling us that you work with the providers here.
Yes.
And so I know with a task this huge and providing such a major service, you have to have collaboration. That is not something that the health department can do alone.
Right.
So we really depend on our community partners in this program as well as in the health education program and anything that when you're a safety provider, you have to rely on the community a lot to really make a difference.
Yeah, I mean, we can recruit and try to find families, but without, our partners letting us know who's out there and who needs services. And then we are fortunate here in Rockingham County that the two OB offices, UNC Rockingham Women's Health and then Family Tree, allow our case managers in non-COVID times to have office hours. So I can have at least one care manager there every day. That way, if
That
the
is
provider,
awesome.
they're filling out the risk screen, but they see that, Susie has an immediate need, they can
Yeah.
bring that to the care manager that's there for the day, and we can start working on things so that woman, that family is getting what they need immediately.
Wonderful. Do you ever work within the student health centers?
We haven't. I mean, we do get referrals for those teenagers, but we haven't gone into the school systems yet.
Okay. Well, that is wonderful, Kim. It really is. How long do the families receive the service? I know you said newborn to up to age 5.
Yeah. With the children, that they're eligible newborn to age 5, and if we have a family that their needs take them through 5 years of services, we will definitely, hang with them that long. But our goal is to work with the family, help them meet their needs, give them the skills so
Yeah.
that they don't need us.
Right.
And then we will, what we call, graduate them from the program. And we always tell them, if they're graduating before 5, hey, if something comes up, call us. If you've got a question, call us.
Yes.
It's one simple click in our computer system and you're back in.
Yeah.
For the pregnant women, again, we can pick them up anytime during their pregnancy, and we do work with them through their second postpartum month. And the neat thing about the way that our program is structured, in our particular county, these are statewide programs, so they're done a little different from county to county. Our case managers do both programs. So if you've got a woman that, I'll just use substance abuse as an example, if she has an active substance abuse issue and she's receiving care management during her pregnancy, then that child's going to qualify. So I'm able to have the same case manager work with her during her pregnancy and also with her
I
child.
didn't know that.
It's done, like I said, different counties do things a little differently. The programs are the same. So if you were to leave here, if we have a family that is receiving services and they decide to move to the beach to get some sun, we can transfer there, and they may have 2 separate sets of staff for the 2 programs. But we've just found, for continuity of services, and when you have told somebody your story and you're comfortable with them, you don't want to move to
No.
somebody new and have to tell that story again. And we found that it works real well for us in Rockingham County.
That is great because people want to have a sense of trust. That's really important, and especially when they're vulnerable.
Yes.
And so that is a great attribute to the program.
And we try to, should, a mom deliver and have our services, and then down the road have a subsequent pregnancy that she qualifies for services again, I try to place them, or we as a unit try to place them with the same case manager again if that person's still with us.
Yeah.
And the same thing, if there's other children, or with our foster families, if there are multiple children from different families placed in their home that require services, we try to keep the same case manager so that, again, it's consistent, and they know they know who's coming in their home, they know who's calling them on the phone, and like you said, they have that trusting and supportive, positive relationship with their case manager.
Okay. Well, I remember earlier you had mentioned you also see people who are not residents of Rockingham County.
No, we see people in the county. If a woman receives care outside of the county, if she goes to a Greensboro OBGYN or, Duke, Chapel Hill, those type of things, if they have a higher risk pregnancy. But yeah, we will see Rockingham County residents. If they live in Caswell, then Caswell has these same programs and they will see their
Gotcha.
residents. We do assist every now and then, especially when I'll just use Caswell for an example. If you've got a Caswell County lady that's coming to Family Tree or UNC Rockingham, we might see them in that office for them just to help them out, and vice versa. Some of our Rockingham County residents that go to Greensboro or Forsyth County Hospital, OBGYNs, we might call and say, hey, I haven't been able to get up with such and such. Do you mind catching her at her next OB appointment?
Right.
So even though it's a statewide program, we kind of cover our own residents, but at times when we need to, and we've also we've helped train other county employees. We recently had a young lady from Person County that there was just no one to train her, and so she came and worked with us for a few days, and then we have a pregnancy care manager coming in this week from another county. So we just try to make sure that our main goal is it's not our people, your people, even though you do have to kind of respect county lines. We want to make sure that any citizen of Rockingham County or North Carolina that needs services is going to get what he or she needs.
That's wonderful. And you hear that, viewers. This is partnership and collaboration for the better good of the county and the area, the state, coming together to work together.
Yes, ma'am.
To the benefit of these families. And that reminds me, and that made me think about how we collaborate, because we received some funding from the Women's Health Branch, from the North Carolina Department of Health and Human Services, as you know, and we're looking at infant mortality reduction. And so that's something that's very important to us and something near and dear. And Kim and I actually work together with different initiatives and wellness programs for these women to reduce infant mortality. And so one of the things we offer is safe sleep classes. And safe sleep classes is a one-time, 1 hour class that just kind of shows the importance of back to sleep, putting the baby on their backs when they're going to sleep. Up to play, back to sleep, right? And so because we received the state funding, we're able to offer a $25 gift card and provide a light meal and a certificate, of course. But yeah, so we've had a lot of interest in the class. Unfortunately, because of COVID, we haven't been able to, host as many classes. However, we're trying to see how we can go virtual with it. Not sure how that will look yet, because it's really a group thing. But and I know you all provide those kind of services as well, expressing the importance of back to sleep.
Yeah.
And so also with the funding, we're able to, because sometimes it's hard for families to have safe places for the babies to sleep and for the babies to play. And what we try to do is not to remove that barrier. And so Kim's program graciously offers pack and plays. And so that helps. If the person is eligible for it, you get it for free.
Right. Yeah, we are always, from the time that we pick up a woman in her pregnancy, and of course after children are born, are almost preaching the safe sleep.
Right.
I think, it's no secret that the infant mortality rate in North Carolina is not where we would like it to be. It is better than it has been.
That's right.
And there are lots of these efforts across the state. Both my staff and Katrina's staff, we are trained safe sleep. So we have a curriculum that we use. And what we do with our moms and any dads that want to participate,
We welcome the dads.
grandmas, anybody that we've had, that want to participate, then we will do for our patients on one-on-one sessions, in addition to, constantly just reminding them and checking in with them. Do you have a safe place for your baby to sleep? Do you know to lay them on their back when they're sleeping, not to have the fluffy pillows and the extra blankets and the teddy bears in there when they're sleeping, because you don't want it. You want to create a safe, secure environment for your babies to sleep in. And once we get to the end of that pregnancy, or if we come across a family after the child is just referred to us for the care management for at-risk children program, they do not have a place for that child to sleep, then we will provide them a pack and play free of charge. We also get calls from DSS. Either they have a child that their Child Protective Services is working with, that is a barrier to keeping that child in the home. That, because we want no child to go into foster care. So if we as the health department can work with that caregiver or parent, or sometimes it's a safety resource that child needs to go stay with for a little bit while the parent deals with some of the things that are going on, then we will, again, do that education. We always do the education. Make sure that family doesn't have any questions, and then, give them that pack and play and make sure that they know how to set it up and to safely use it. And this year we've been lucky enough, it's getting colder. And I know my daughter's not a baby anymore, but you were always worried about, they're going to get cold. We were fortunate enough this year, the money that we received allow us to buy a few sleep sacks, which I call it like a sleeping bag with arms. And so instead of putting a bunch of blankets on little Johnny or little Susie that they may, as they move around, pull up on their face, it's a zip up sack. It's like I said, it's a sleeping bag, but it's like a shirt at the top. So we've been fortunate, and we're excited now that it's getting colder that we'll be able to give out those sleep sacks too.
Wonderful, that is great. And then another thing about the Safe Sleep during the consultation, we also discussed the importance of not co-sleeping.
Right.
That is sleeping either with a parent or another sibling, because that can increase the risk of SIDS or suffocation. And so it's a lot of things that is covered during those conversations when you're with your clients, or even when we're facilitating a class. And it's a great talk, and it's a lot of things that you really didn't understand how important just behaviors are, and ideals, and what people say, well, I put my
Granny
baby,
did that.
and they were fine. And so it's a lot of customs and things. It's a way of trying to change the behavior that has been set in stone, generation after generation and generation. And I think that when you're providing the information to the individuals, and I'm so happy to see the fathers in there too, but when you're providing this information to those individuals, it's like something clicks, and because it's scientifically based, and it's sound, and you really can't argue with science.
And it's like you were talking about with the custom. We do our best to be very respectful of family customs, ethnic and traditions that come from other cultures of ours, but then provide them with like you said, the scientific. We have flip charts. We have the information both in English and Spanish. If it's a non-English speaking that we don't have an interpreter for, we have a language line that we'll make sure that, however we can but we, again, try to be just real respectful, because, you don't want to make anyone feel like that their culture, their traditions, what Granny used to always do, that we're making fun of it or telling them it was quote unquote wrong, but just let them know, hey, this is some things that have happened over the past few years, and our main goal is to make sure that your child and your family are safe and well, and doing those things with them.
And a great thing about the program too is that it gives people skills to have those conversations with the grandma and other individuals that think, that, well, this is how we've always done it. So it carries on. It carries on. So I think it's a great program, and we really enjoy that. Another thing we do, we have a smoke-free cessation, a free smoking cessation class that's just geared to women. And we also offer it to the general public, but because we're so focused on infant mortality reduction, we host these smoking cessation classes for women that are pregnant, parents, caregivers, or of babies under the age of 1. Well, to the age of 18, actually, because our purpose is to stop the secondhand smoke exposure and the third-hand smoke
Right.
exposure. And I know some people like third hand, never heard of third hand. Well, the second hand, as you know, is when you're actually exposed to the smoke itself and the dangers of that. But third-hand smoke is when you're a smoker and you have it on your clothes, or it's in your curtains, it's on your furniture and things like that, and it holds in those particles. That's just as dangerous. And so when we have these classes for the women, I call it Smoking Mamas, and when we have these classes, it's a way for them to come together and kind of fellowship. And so we have our parking lot talk, but then, we stay focused on, just trying to help them successfully quit smoking. It is a 1-hour class once a week for 4 weeks. And because of funding, we are able to incentivize. And so if anyone's interested, you can go on our website. This is the smoke-free class on smoking cessation flyer. And this is a picture of the Safe Sleep flyer. And it was what is so important about this flyer that struck me was that this 1-hour class could save your child's life. If you want more information about the classes, just give me a call. Again, my name is Katrina White, and my number is 336-342-8150. Or you can visit our website and get additional information. And our website address is www.rockinghamcountydhhs.org. So, Kim, I want to thank you so much for bringing all of this information to the citizens in the community, because we want them to know that we are here for them. And we want to make everyone as healthy, as happy, as safe as we can. And it takes a village to do that. So.
And I thank you for both having me here today, but also for you and your staff for allowing our folks to send you clients for these classes.
We really
because,
appreciate it.
like you said, for collaboration, we can't do it all. You can't do it all. We all do it together.
Thank you so much.
Thank you.
Thank you, everyone, and have a good day.